My name is Tom Lenart. I'm a pediatric ophthalmologist or a children's eye doctor. My office is in Redmond, Washington. It's the Children's and Family Eye Doctors. I've been associated with Proliance for about 3 years now, married to my wife Sylvia, now going on 26 years. I have a couple of children, Andrew, 22, and Nikki, who's 20. I went to medical school at the University of Pennsylvania. There I received an MD as well as a PhD in biophysics, specifically in muscle physiology. Did a residency at Mayo Clinic in Rochester, Minnesota, a fellowship at Emory University, been practicing in Redmond for now 20 years. I do routine pediatric eye exams in addition to surgery. The surgery subspecialty that I do is specific to pediatric ophthalmology, but as well there's a small component that involves adults. Strabismus surgery, or surgery to correct misalignment of one's eyes, can be performed on both children and adults, and the pediatric ophthalmologists are the surgeons that work on the adults as well as the children. There are other types of surgery I perform on children, which include clogged tear duct surgery, nasolacrimal duct surgery, which can be performed even in my office, depending on the age and weight of the child. I also do this in the hospital. Cataract surgery in children. Some children are born with cataracts, others develop cataracts secondary to trauma. And then stye surgery or chalazion surgery on children, as well as eyelid lesions. That's the primary bulk of the type of surgery that I do. I have a child-friendly office with a very kind staff. So when a child comes to our office, we're looking to have that child have a great experience. And so I have a couple of optometrists that are there as well. They also see adults and children. And assistant Muno is her name, and she's a very patient and kind and friendly person who works up my patients. She's an orthoptist who's a type of paramedical person who works up patients for pediatric ophthalmologists and is expert in that area. You know, as a pediatric ophthalmologist, I've kind of dedicated my life to serve children, serving children in the sense of wanting to make sure that their eyes are healthy, that they have good vision and able to enjoy that sense as they're growing up and into adulthood. I'm also a football coach at Woodinville High School. There I work with young men in that program, and again dedicated to children and young folks in my community. I also serve in my church in the children's program as a children's leader, helping teach and train children of all different ages and grade levels. So I'm a pediatric ophthalmologist, and the main type of surgery I do is strabismus surgery for children and adults. Interestingly, adult strabismus surgery has become a keen interest for me. Many adults are told, unfortunately, it's a result of my own field, that they can't have the surgery. They're too old for the surgery. They're too old to do anything, and they just have to live with their misalignment of the eyes. And that's incorrect. There are multiple options for adults with strabismus. I have a lot of experience with adults, and in particular, adults with thyroid eye disease. And so I find I have a keen interest in that. Of the surgeries I do, strabismus surgeries, about 40% are adults, 60% are children. I love doing surgery on the children as well. That's why I went into the field, but adults hold a special place in my heart for that kind of surgery. Also, pediatric cataract is another niche that I'm trained in. Some children are born with cataracts, others develop cataracts when they get a little older, some from trauma, some from just metabolic reasons. But doing cataract surgery in children is a little different than doing it in adults. In adults, it's an outpatient kind of a situation where they're awake during the surgery. With children, it's a little different, and they are asleep. They have to be asleep to be able to do the surgery. And it takes a special training to do that, which I'm trained for and have a passion for that. We have a large capacity to get patients in a timely manner. A lot of parents that are told that their child needs to see an eye doctor are very nervous about what the result of the exam is going to be and don't want to wait. We totally understand that, and so we have a big advantage to our offices that we can get them in a timely manner. And we would ask that if a patient were to come to our office, just come a little early, fill out the paperwork so that the child isn't sitting around, waiting. If you can get it done beforehand, anything to do to get the child involved in the exam as soon as possible so that their patients don't run out. Typically the child will be brought back to the exam room by Muno, my assistant, and a few things will be done, including getting their vision as well as a few other tests. And after the initial workup, then children that are in my office for the first time will need eye drops. That's the hard part of the exam, because most children don't want the eye drops, but Muno's very, very kind in how she delivers the eye drops. And it's critical that we put those in, because that will allow me to be able to determine the health of the eye, as well as any refractive errors, meaning farsighted, nearsightedness, astigmatism. The time for the dilation to occur is about 20 minutes or so, and the child typically is allowed to go back out to the playroom, or in the room we have a video going, something to keep the child occupied for 20 minutes. And then I come in and complete the exam with looking at the health of the eye and the refractive error, take time to explain to the parent exactly what the findings are, what if glasses are needed, surgery is needed, if nothing is needed, and then what the follow-up program would be after the exam. When we're all done, both parent and child go to the front. The parents schedule the next exam, and the child gets to choose a prize. We have a prize box up front, and that's always a bright part of the experience in our office.